Up next, a special panel discussion with the Missouri Department of Mental Health Leadership. This is the second panel discussion with DMH leadership. During today's presentation, individuals will again be able to ask questions and learn new information by using the chat feature. Deborah Walker will again facilitate the discussion. The speakers on this morning's panel include Director Mark Stringer, Deputy Director Valerie Houn, and Division of Developmental Disabilities Deputy Director Wendy Whitsick.
Hello and good morning to our esteemed panel of team members here at the Department of Mental Health. We are so grateful to have you with us today. Thank you, thank you, thank you.
Thank you.
I would like to, yesterday I totally missed this. I was so excited to get into the content. I totally missed it. So I'm gonna do things in the right order today. And Director Mark Stringer has shared part of his day with us today, and we're excited to have you with us, Mark. So I'm going to have each of you just do a quick introduction as to who you are and your role at the department, maybe how long you've been in that role, and we'll move through into some questions after you introduce yourself. So Director Stringer, I'll put you on the spot first.
Okay, thanks, Deb, and thanks for having me. Yeah, my name is Mark Stringer, and I'm the director of the Department of Mental Health. I've been in the director role since 2015, which makes it 6 years. And before that, I was the division director for the Division of Behavioral Health. And so I've been with DMH actually since 2001. So that's what, 20 years. So I've been very proud to be director of the department. This is probably the best job I've ever had, despite all the challenges that we face as a department and for the people that we serve. But it's still a great job, and I guess that's probably enough, Deb.
All right, thank you, Mark. Val, let me toss it to you. I know that. I totally appreciate you spending time with us both yesterday and today. But because I did things out of order, why don't you share with us again a brief intro on you and your position, and so take it away, Val.
All right, thanks, Deb. My name is Valerie Houn. I've been with the Department of Mental Health since 2014. That is when I became the director of the Division of Developmental Disabilities, which was also one of my favorite jobs ever. Then last year, I moved over to the deputy director position, and I am now the deputy director for the Department of Mental Health, which brings a whole new set of fun things to work through. I was really excited just to finish those respect speakers that were on. They did a fantastic job. It was nice to see everyone too. And I do look forward to us being in person next year so that we can actually talk to everybody.
Absolutely. Thank you, Val. We are looking forward to that as well. This is actually one of the favorite segments of our participants at the Real Voices, Real Choices conference. And I know that certainly Val, you and Mark have been in that experience in the really nice, large ballroom, and we're just passing the mic around, and there are some really very sophisticated questions that our participants, our consumers share, and it's just awesome to be able to at least have a small segment of that incorporated into this year's conference, even though we are virtual. One day we will be back in person again, and we'll get the chance to do that. I want to introduce now Wendy Whitsick, who is with us. She's representing the Division of Developmental Disabilities. So Wendy, I'll kick it over to you. You can introduce yourself.
Hi, good morning, everybody. I'm Wendy Whitsick, and I actually got my start in the field with most of my training coming directly from you all, the people that I supported and the providers that I worked with, and worked in the field up until 2016 when I got the wonderful opportunity for the role that I'm in now. So I have been in this position for 5 years, and like Mark, I absolutely love it. It is a great group of people to work with, and I couldn't be more privileged.
Awesome. Thank you, Wendy. We really appreciate you being with us today. And Wendy, we should also say she's the Deputy Director in the Division of Developmental Disabilities. Our Director of the Division of Developmental Disabilities just happens to be on vacation this week. So, next year we'll have to make sure she carves out this time so that she can be with us. Her name is Jessica Bax. She is relatively new to the Department of Mental Health, but comes with a really deep background in serving individuals with intellectual and developmental disabilities. So we are really thrilled to have Jessica at the Department of Mental Health, and I know that she will be looking forward to meeting our participants once again when we're able to be in person and moving forward with the conference. So I will just start with a question to you, Mark, about, it's not always an easy job to be the director of the Department of Mental Health, and certainly COVID has created many, many more challenges than we ever actually anticipated. I mean, nobody saw this coming. Absolutely just have floored us in many ways. And so can you talk a little bit about how the department has managed through the COVID pandemic, and maybe what are we looking at going into the fall, and some of the things you're perhaps concerned about, and ways that we're going to move forward regardless?
Yeah, thanks, Deb. And by the way, I too miss the ballroom and passing the mic around. That for me was always one of the highlights of the conference. So as you say, we'll get back to that someday. We've been doing like a lot of organizations have, and that is learning a lot as we go. We have some fantastic leaders involved in steering the department, and I'm not referring to myself, but people like Dr. Angeline Stanislaus and Val and Carrie Tesreau. We've got some real stars that are helping us navigate these troubled waters here. What worries me about going into the fall is that and these things are interrelated, but the fact that we have so many people in Missouri that are still unvaccinated. There's just a little over a half, maybe 53% of the Missouri population, 12 and older, that have been vaccinated, and we're way into this thing now. And what worries me about that is that number one, of course, there's still a tremendous amount of misinformation floating around out there. You can find all kinds of nonsense on social media, and that just continues to spread. And a lot of people believe in that stuff. So all that just perpetuates this problem of people not being vaccinated. And when people are not vaccinated, when that many people are not vaccinated, this virus has mutated and will continue to mutate. I always say that we've created a playground for the virus, and it could conceivably mutate to the point where the current vaccines are not nearly as effective. My hope is that we begin to see that vaccination rate increase, and that people take this very seriously. There are still way too many people who think that this is a hoax, some effort by the government to get control, things like that. And a lot of those people, I mean, they're not a lot. Their minds change when they find themselves on a ventilator, or a loved one is on a ventilator. And I've heard doctors say, I cannot count how many people have said, "Gosh, I guess I should have taken this seriously." So I'm hoping that most of the people at the conference here have been vaccinated. And part of that is because, and the last thing related to not being vaccinated is that it makes, we already have staffing shortages in the Department of Mental Health. And so it makes our staffing challenges even worse if our staff gets sick. And we have lost staff and patients to COVID. When I say lost, I mean they have died from COVID. And that is a tremendous tragedy, and we grieve every one of those deaths. So on that happy note, I mean that's what I'm concerned about, is that we're going into the fall, which is traditional flu season, without a lot of people being vaccinated, and we're I think we're in for a rough road ahead. And so I'll kick it back to you, Deb.
All right, thank you, Mark. We appreciate that information. And as Mark was speaking, you probably saw the website come up, health.mo.gov. And Val, we talked about this a little bit yesterday when you were on the panel, how important, and Mark referred to it as well, how important it is to find reliable sources for information regarding COVID, because there is a lot of misinformation out there. So if you could kind of touch on that again, and then just, in general, where can people get vaccinated?
Well, Deb, thank you. And I would like to point out there's another website for you to go to. It's called covidvaccine.mo.gov. And that is really the state's portal to vaccination, all information vaccination. Remember, anyone 12 and up in Missouri can get a vaccination at this point. And there are lots of places where you can go to get vaccinations. If you're concerned about where to go, or you've got mobility issues, please contact your county health department. And every county has somebody you can contact. A lot of those have clinic days for vaccination. If you have a certain type of vaccination you would like to get, they can help direct you to where that vaccination will be available in your county. Also, a lot of those folks will provide drive-up service. So you don't have to get out of the car, walk in the door, because I know mobility is an issue, anxiety is an issue. So they are all there to help you get vaccinated. So if you're coming up with reasons not to get vaccinated, and they include mobility or anxiety or not having enough information, check out the covidvaccine.mo.gov website. There's information on there. There's frequently asked questions on there. There's facts on there. I'm cheating and looking over at it right now. There's also the data on the number of people in Missouri that have been vaccinated, and by age. And another thing I want to bring up is that we do have a vaccine incentive program going on right now. And if you've already been vaccinated, which I love seeing in the chat, all of the people who've already been vaccinated, I've been vaccinated, my husband's been vaccinated, all of our parents have been vaccinated. And I've got one kid who 2 days after his 12th birthday went and got his first vaccination. I got another kid that's 10, and he's like as big as a 12-year-old, but we can't get him vaccinated yet. So, but he would like to go, and he's ready to go. So that's exciting for me. And actually, I love to hear him talk about it with his friends too, about being vaccinated and about how excited he is. But there is also another program going on in Missouri right now to help encourage folks to get vaccinated, as well as celebrate those that have been vaccinated. And that is the Be a Mo VIP winner. And you can register to win, and I'm clicking so I don't get anything wrong here. But wait, that was actually the registration page, which I've already done that too. But you can actually, I got to scroll down. You can win up to $10,000. They're going to do 8 different drawings. They've already done the first drawing, and it's based on your congressional, the boundaries are based on your congressional area. So it's not just 8 prizes for the whole state. It's actually more than that. And your category will depend on when you got vaccinated. So if you were vaccinated prior to July 21st, you fall into one category. If you've been vaccinated since July 21st, you fall into another category. If you are between the ages of 12 and 17, you fall into a third category. And that's because we're not giving the 12 to 17-year-olds $10,000 cash, but we are giving them $10,000 for their MOST account, a savings account for higher education or education. So I noticed that link is up there right now. If you have not registered, do so. You can do it online. It's very easy. You will need to know the date of your vaccination. There's some other details in there that you can include, but you don't have to include, and that won't inhibit your ability to win. So I wanted to make sure everybody was aware of that opportunity. Also, if you're on that COVID vaccine website, you'll see there's also Six Flags tickets available for certain parts of the state if you go and get a vaccination now, moving forward. And that's going to be in places around the St. Louis area. But there's a list of where, if you get vaccinated at those locations, you can access Six Flags. They will give you Six Flags tickets as well. So, and I agree, there are some people that cannot be vaccinated. And that's why the rest of us, it is so important that we do get vaccinated. And really the number one reason why my 12-year-old wanted to go 2 days afterwards, he's got a friend that he knows will not be able to get vaccinated. And he doesn't want to risk that. So, Yay!
Awesome.
Anyway,
I am so glad you brought that information up. That was something we didn't mention yesterday, and what a great incentive for individuals to just quickly online sign up and have the opportunity to perhaps be one of those incentive winners. And as you said, they are happening all over the state, and people of all ages and backgrounds. So awesome opportunity. Thank you for bringing that up today, Val. I really appreciate it. And, we talked a little bit yesterday as well that while the majority of things that have occurred around COVID-19 have not been positive, there are some silver linings to COVID-19. And what I'm speaking about is Station MD. And that's something that I'm going to toss over to Wendy to tell us a little bit about. Yesterday, we talked about it on this brief panel. And then there was a presentation yesterday as well from the Station MD doc, who Dr. Malik, who was able to share some more in-depth information. But for those who weren't able to join us yesterday for that particular presentation, Wendy, would you tell us a little bit about Station MD and how it has kind of been the silver lining coming from the COVID pandemic, but we found it to be so beneficial that even when the pandemic goes away, which we hope and pray one of these days it will, I believe we're going to be keeping Station MD. So tell us a little bit about that, Wendy. Oh, you may be muted. Are you muted?
Yep.
Okay. There we go.
Somebody's got to do it. I'm glad
Try
to take
again.
that one for the team. So
Usually
no,
it's Mark, so.
Thanks, Deb. Yes, the partnership with Station MD has been amazing, and it couldn't have been timed any better with the advent of the pandemic. It really has offered a lot of peace of mind to individuals, their families, and the staff working in programs. It's available. It is a telehealth service that is available to individuals that are eligible for our waivers on the DD side. And it doesn't matter if you are living at home with your family, if you live by yourself in your own home, if you are with a provider in an ISL or a group home or another living arrangement, or maybe you're just receiving some in-home services. It is available to anybody that is using our as eligible for our DD waiver services. And it is it's like a bridge to an emergency assessment or an assessment, a health assessment, when you're not feeling well, maybe you've got an injury, you're not sure if you need to be seen at an urgent care or an ER, you really think you need to have a doctor look at it, but especially during COVID, where people don't want to go to the ER or the urgent care because that's where all the COVID patients are. You don't want to expose yourself. And so this service allows you to get online, either visually through a computer where you can see each other like we are today, or it can just be by phone. If somebody doesn't have the technology to do the virtual visual visit, you can do it by phone and talk with an ER doc who is specially trained on how to work with individuals that have specialized needs that might be related to developmental disabilities, and to assess whatever is going on, whether it is someone that isn't feeling well, maybe they're concerned if they have COVID. Are these symptoms? Is it something else? Maybe there's a rash that they're not sure what it is and they want to have it looked at. Maybe they've fallen and their ankle hurts and they're swelling. And so before you just go to the ER, you want to have maybe another doc look at it and say, you know what, why don't you do this? Why don't you ice it and take some ibuprofen, or they can direct you to do some things that might help you not have to go to the ER visit or to go to an urgent care center to be assessed in person. But if it is something serious or they think takes more of an assessment than what they're able to do virtually, then they will tell you that you need to go on to the ER, and they will call the ER that you're going to directly and talk with those docs there about, this is what's going on, this is what we've talked about, this is what we've done so far, so that when you get there, you don't have all the background information that you have to give out. And it really helps to speed up your experience in the ER. which is valuable to the hospital and their staff as well as to you, who you don't want to spend hours sitting there waiting on the assessments and all that to happen. Then they will also follow up with your doctor, your personal doctor, to say, hey, I talked with your patient over the weekend. This is what was going on. This is what we did. They may need to have a follow-up visit, or I've recommended to them that they have a follow-up visit with you in a week or whatever. So I want to emphasize that this is not to replace your personal doctor. This is just an extra benefit. This is an added layer of comfort and protection and assessment that you can get when your doctor's not available to you. They get a lot of calls on nights and weekends, but also throughout the day, because rarely are you able to get in to see your doctor same day, right? So you're going to urgent cares or you're going to the ER. So this allows you to have just another step before you would need to make the decision to go on to the ER. Now, I also want to say that if it is something urgent and really serious, you're bleeding a lot, or there is something that you are really concerned, life and death concerned, you wouldn't call Station MD. You would call 911 and go directly to the ER. So they don't replace the ER. They're just kind of that middle ground to give you another option and your family and the staff another option. They're available for questions. Sometimes they just take a lot of calls to answer questions about COVID-19, about what they need to do in follow-up to something else that's hurting or bothering them. So it's just really nice to always have a doctor that you can reach out and talk to in real time and have that access to. Also, want to point out that depending upon some of your conditions, maybe you're someone that has a chronic health condition, maybe it's a heart issue or a breathing issue. They also have specialized equipment such as a stethoscope that they can plug into an iPad or a computer, or you can, and they can actually hear your lung sounds. They can hear your heartbeat. And so they can do that level of assessment as well through whatever device you're using, whether it be a computer or a tablet. It's just pretty exciting just to hear some of the testimonials that we have heard from people and their parents who have just felt that it gave them great peace of mind to have somebody that they could talk to and not sit and fret about and worry, should we go, shouldn't we go, what is the risk of going. I know, like Val was talking to, a lot of people have mobility issues. They have anxiety about going to, the doctors and the hospitals, or it's just not someone who can tolerate sitting for 5 hours in an ER room. I have some personal experience with that, and it's a lot for me. So it's just, there's a lot of really wonderful testimonials out there for how it's helped people and how they've appreciated it. So if you're not familiar with it, we really encourage you to talk with your support coordinator about it, talk with your staff about it, get online. You can get on our website for the Division of Developmental Disabilities, and there's a button on there that says Station MD that will give you some more information about it, and you can reach out and just get some more information. So I encourage you to check into it and look it out. And like Deb said, it is going to be around long after the pandemic is gone. So don't think of this as a service that's just related to COVID. It is for anything that ails you.
Awesome. Thank you, Wendy. That is so true. And it is amazing the way that the technology has evolved, that a doctor can actually take some of those vital signs just, through a telehealth process. That is absolutely incredible, and a wonderful change that has occurred due to the fact that we have had to sort of isolate ourselves a little bit because of the pandemic. So there are some good things that have happened and have sort of forced us to do because of the pandemic. So thanks for explaining that, Wendy. I also want to mention that If you want even more detailed information, you can go back after this conference is over and check out the not only this panel again, but you can check out the recording of the Station MD presentation that was given yesterday, and you can get even more detailed information. So really appreciate you providing that information, Wendy. And we are starting to wrap things up here with our DMH panel. But before we do, I'm going to toss it back to Mark. Anything else you'd like to share with our participants in our Real Voices, Real Choices conference this year?
Thanks, Deb. No, just I wish I could see everybody. Again, I miss that. I miss that in-person experience. I even miss the karaoke, which I'm assuming we're not going to do this year. It'd be very tough to do this way. But anyway, I just thank you all for participating in the conference. It means a lot to us, certainly, and I hope it's very valuable to you. So I will kick it back over to you, Deb or Val, or.
Yeah, let's toss it back to Val. Val, any last minute comments? Anything we haven't covered that you want to throw in at the last minute here to share with our participants?
Well, I want everybody to know that across the state and across the country, supporting our direct care workers is a priority for all of us. And it's through COVID, it has been a constant struggle for them. And we're so proud of the work that they do every day. And we are constantly looking for ways to recruit the best help we can, to train the best help that's out there, and to make sure that the supports we help people have are the best that they can be. So remember to thank your direct support workers if you've got anybody helping support you at all, and we thank them every day and think of everything that they do.
Thank you, Val. Absolutely. Our direct support professionals are our frontline people, and we need to do everything we can to support them. Wendy, any last comments before we let you all go for the day? We appreciate the time that you all have given to be with us on the panel. Wendy?
I just want to congratulate and thank everybody for how amazing everybody has worked together during this past year and some months through COVID. Those of you receiving services, your families and providers, really working through some unprecedented times, trying to figure things out and how to keep everybody safe and protect in the best way possible. And it has taken a lot of partnership and a lot of working together. So thank you for all of that, and stay safe. Get vaccinated.
Awesome. Thank you so much. I see in the chat, Mark, that I believe David Stoker has challenged you to perhaps lead the YMCA dance when the next time we are there in person for the dance and the karaoke part of the event. Are you up for that?
Yeah, well, I did notice it in the chat, and I'm afraid my friend David is just trying to re-traumatize me, and that's wrong, David. That's just wrong. We'll see.
All right, we will see. We will definitely look forward to that opportunity. Let's see. Okay, I think I'm not seeing any specific questions in the chat. So with that, once again, I would like to just thank Director Mark Stringer, Deputy Director Valerie Houn, and Deputy Director of Division of Developmental Disabilities, Wendy Whitsick, for joining us today. We appreciate your time, and thanks so much for being with us.